really settled down a lot. We've given them a lot of information.
Oh, fantastic. Well, thanks for that. Look, from what everyone's saying, it really does sound like Michael's improved a great deal and will be ready for discharge at the end of the week. I think we all agree on that. So I popped in and saw Michael as I was coming into the meeting, and he knows that his parents are going to come in for discharge planning, then he'll join us to plan for the discharge, so he's okay with that. So, Jane, were you okay to go and get
Yes, that's fine.
Mr. and Mrs. Davis, Helen and Richard?
That's right.
Thanks.
Yeah.
Thanks so much. Helen and Richard, thank you very much for joining us. I'm Dr. Leanne Betts. I'm a consultant psychiatrist that works with the inpatient unit and the team here. It's very important that we work closely with families when one of our patients is being discharged, so thanks for making time to join us.
Thank you.
Can I just check that you're familiar with all the members of our team here? I think perhaps I should need to introduce Elise, who's the OT on our ward, and Chris, who's the primary nurse who's been working with Michael. And it also reminds me I need to introduce Frances Green. Frances, I'm very appreciative, has come in from the community, and she's the clinician who'll be working with Michael and yourselves when Michael is discharged. One of the things we'll do today is talk with you just separately, and then we'll ask Michael to join us to finalise the discharge planning.
Thank you. We do have some concerns that we prefer not to worry Michael about, of course.
Yep.
Well, look, why don't we start with hearing about some of those concerns?
Michael is a lot better, but I'm really scared that he's going to go downhill again and he's going to get back into the drugs.
Well, it was really terrible for Helen, like when Michael went missing. And I don't want him to put her through that again.
Yeah, oh, okay.
You know, it was a pretty traumatic event.
Yeah, I can understand that was a very difficult time. Look, what's obvious for me from the brief time I've met you, but of course from what I've heard from the team, is as a family how hard you've tried to struggle with this and to get help. Your comments about drugs, that's a major worry for many families, and it's a tough one, and perhaps we'll come back to that. But what I'd like to start with today is just clarifying safety. From when I've met with Michael and when, from what I've heard from the team, they've never had worries that Michael might actually try to harm himself. Is that correct from your point of view?
No, he's never harmed himself.
That's good. I mean, that's important. Just another safety question then. Have you got any worries that when he comes home that anyone in the family's safety might be at risk in any way?
No, not really, but you know, like Michael does have some really strange behaviour, and when he starts to use the drugs, it affects the kids and my relationship with my husband.
It's really hard for any family to know what to do. I think I spoke to you about the family psychoeducation groups and also the local carer organisation for some support.
Yeah, somebody phoned us about that, and we'll go along next month.
Yeah.
Okay. Look, I think you'll find those very helpful. What other ways could our mental health service be helpful to you and your family when Michael comes home?
Well, it'd be a good thing if somebody could ring us and talk to us in case things get worse again.
Yeah.
I'll be keeping in contact with you regularly, with all the family, and my job is to actually connect up with Michael weekly at the Community Health Centre and to arrange medical reviews with the doctor about his medication. And I'd also like to introduce Michael and yourselves to the alcohol and drug worker.
That sounds great. At least we won't be on our own again.
What about Michael going back to work?
Yes, there's actually staff in our service that can help Michael with that too. So how does that sound?
That sounds great. But I'm worried about the kids though. I mean, you gave me the fact sheets and I've read through and they're great, but I just don't know what to say to them.
Helen, I'm actually happy to meet with you and the other kids sometime this week if you'd like to. And Frances, would you be free for that?
Yes, that's fine.
What do you think? Would that be a helpful thing?
Oh, thanks so much. It'd be a great relief.
Okay.
Fantastic. Well, look, just a final question. Are you clear on the in and after hours contact numbers for the service, especially after hours if things got difficult?
Yes. People have been fantastic.
Yeah.
Fantastic. I think Philip and Jane discussed those with you.
Yeah.
All right. Well, look, why don't we ask Michael to join us now and we'll proceed a bit further with the discharge planning.
Okay, I'll go and get him then.
Thanks, Philip. Well, it's great to see how far things have come, Michael. There's a good plan in place, so good luck.
Yeah, you're going to be all right.